All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is the second for today. And yes, today Jim is first. Steve said first, but Steve, I think Jim was first today. So welcome. And Margaret, how are you? Jim, welcome. Steve, welcome. DDS, welcome. Carolyn, welcome. Doug, fifth. RM, RB, mom. And Dorothy, how are you? John Snyder, who is first. I think today's, at least on my list, Jim is first. Denise, hello. Michelle, hello. Nina, hello. Nina, you said you were scared. Hopefully you're okay. Doug said, hello. Cher says, oh man. DDS says, Jim won. Roller girl, hi. Hi, back to you. Priya, hello. And then there is a lot. I'm just going to now quickly say hello to everyone. Zelena, Connie, Anna, Kathy, R. Geezer. Oh, so R. Geezer, Dr. Bean, honestly, why have you not gotten I haven't gotten a number yet, just like Dr. Corey, because I don't practice. Dr. Corey is not practicing as well. And so I am not technically a healthcare worker because I'm not exposed. And so I can't get it other than with the average, queue in which I will be. Hey, Andrea, how are you? Hello, A. Rocky, I'm DOS. DDS, how are you? Geezer, hello. John Snyder. Romana says, good evening, Dr. Bean. Sorry about reposting my comment again, but I would like your opinion. I suspect that Bell's palsy may be coming from a reactivation of HSV1 or zoster virus. I had that happen twice as a reaction to a flu shot. That worse headache comment would be also consistent with the herpetic reactivation. In most cases, that pulses resolve on their own and patients do recover. And I would tend to agree with you. I agree that it's either the vaccination or the actual virus as well cause enough of the immune system trigger and distraction that the other viruses do get a chance to start popping up. And the thing that I like, so I had been looking at these numbers the majority of the day today, not the whole day. And in most cases, I saw that these resolved. So yes, I agree with you. And I am hoping that if there were cases that were not resolving of transverse myelitis, Bell's palsy, or other bleeding disorders, they would report them. I am not seeing them reported the way we saw them in here. So Denise, did you have a... Siddhartha says, hello, back to you. Hey, Sepal Steve, how are you? Charles, how are you? Beryl, good night, everyone. Good night. Texas, Meg, hey, Al. Hey, back to you as well. Christy, Nina says, like me, Dr. Bean. Congratulations, Michelle Horodnik. Congratulations, GMT Hero. I'm sure you worked very hard. Hi, Dr. Bean. Hi, Samina. How are you doing? Dorothy Hughes. Question for my friend who is an engineer at Novavax. Is there any question that you'd like me to ask him? Oh, that is a very, very important one. So the most important thing for Novavax that I have is, when are they actually going to publish the PDF, the actual data that we can look at? For example, yesterday's data did not have the adverse effects reported correctly. All it said was adverse effects were balanced between the placebo and the other arm, but not really what were the adverse effects. So that would be very interesting to know. And it would be interesting to know when they are going to publish the data, but I think that person may not have good information on that and may not be able to disclose it. Yes. So Denise says, interestingly, many of these side effects are what I had as active infection and still neurosymptoms still as long hauler. Could it be due to spike protein crossing blood-brain barrier? Denise, spike protein alone cannot cross blood-brain barrier. The reason for that, so let me back up. Wrong statement. Spike protein can cross blood-brain barrier, but spike protein alone is usually not found in actively infected people. The reason for that is, if I can quickly draw it, that doesn't mean that the neurological symptoms are not related to the infection. There is something that is going on. Is that the spike proteins, or is that the antigens from the virus, or is that the inflammatory cytokines entering the brain and then bugging it, or is it the nasal pathway which is getting the congestion that we saw and then causing the neurological symptoms? We have to still figure that one out. But generally, I'm just going to show you a concept for why these antigens are usually not seen alone. And I see this question, even yesterday I saw one of the comments under the YouTube video that spike proteins are just going to be a lot in the blood and then they will go everywhere. I had done that video before, that it usually does not happen. Here, very, very quickly, active infection. So let's say active infection is in this cell. So here is a cell. This cell has coronavirus. Virus has arrived in, fused with the cell membrane, and brought the RNA in. Now what happens is, this RNA, as we know, will bind with the ribosomes, and the result is we'll make the whole virus here, not just a spike protein, because this is not a vaccine, this is actual virus. These viruses would then come out, and they have their spike proteins with them. Then they would enter another cell, and this cycle would continue. Now, in the meantime, the viruses are going to start getting destroyed as well. And there are multiple mechanisms that would work. One of the mechanisms is that this cell that was sick with the virus would have less cluster of designations on it. And cluster of designation, those cool beans that have been with me from the beginning of the, from last year's April, May time, I have been giving this example that the cluster of designation is like hair, and you can identify someone from their hair. These are proteins that are, imagine if the cell surface is like an ocean, these proteins are like little ships that are just, floating around. And humans, we can actually identify them and say CD8 on cytotoxic T cell and CD4 on helper T cell and so on. The natural killer cells are also very apt. I usually make natural killer cells like this. So natural killer cells, remember in the beginning I used to talk about it, natural killer cells are like little perverts. They would touch every cell. Wherever they go, imagine natural killer cells just roaming around in our whole body. And wherever they go, they touch the cell nearby. What are they trying to do? They are trying to figure out the cluster of designations density. And that means if they're going to pass near me, they're going to touch me and see if I have hair. And if the cluster of designations are missing, the proteins are missing, that means that the cell either has a cancer in it and is not able to make its normal standard proteins, or it has an infection in it, and that infection system, the virus has taken over the cell's machinery, and the cell is not able to make the right density of its own proteins. And so when natural killer cell sees that, it would destroy this cell. And we have done that discussion that it would cause perforations in it, or create perforins and throw perforins and then granzymes and destroy this cell. Now, if this cell is destroyed, and let's say this cell had some half-baked viruses, some spike protein was yet made but not fully assembled. So imagine if spike proteins were tires. We have a few car bodies made, but the tires are not yet installed in the car body, and they were just sitting in the cell. Once the cell is destroyed, these spike proteins can come out. Now, these spike proteins are going to be immediately picked up by which two cells? Cool beans. Which two cells? Uh, Macrophages and dendritic cells. Even neutrophils will pick them up as well. So the cells that are present in the vicinity, and they're present everywhere, they would immediately start picking these proteins up, and then they would shred them, digest them, and throw them, and not throw them, destroy them and digest them. This is the normal, natural outcome of any cell spilling its guts when it is destroyed. Now, if you said that, hey, is it possible that some of these spike proteins will enter the blood system? It is possible, but think about it, that how much that spike protein has to do. Ideally, spike protein or other broken parts of the cell and the virus. Ideally, what happens is, from a tissue where the war is going on, this debris, the big chunks of broken things, are washed away by lymphatics into the local lymph nodes. And over there, they are also then, number one, filtered out, looked at, and then the remaining lymph, the clean lymph, is removed, moved back into blood. So this is one pathway where the proteins would end up in the lymph node, and over there they will be once again picked up. It will be really difficult that some broken pieces escape into the blood system. This is why normally when we get infections, our infections do not cause sepsis. They do not cause blood problems or viremias or bacteremias. And when they cause it, it becomes serious for us. Viremia or bacteremia can be life-threatening, because majority of the debris is picked up by macrophages and dendritic cell. Then a lot of debris is sent to the lymph node, where they are further cleared out. And let's say we still want to see that maybe they can enter the blood. So that will mean what we have to do is, the blood vessel, normal blood vessel, does not have spaces in it for these things to enter. Imagine it's like a thick rubber pipe, and so things cannot just get in or get out. But the capillaries, the smallest blood vessels, are only made up of small, thin cells, and there are spaces within the cells or between the cells, and things can enter or come out through these, still not proteins, but sodium and chloride and other nutrients, oxygens and those things. Oxygen can just cross, and carbon dioxide can cross the whole cell itself. So for a spike protein to be able to get out, we need the blood vessel to become permeable. And please remember, permeable blood vessels are not an easy thing or not a normal thing. For example, those with the renal issue, in those folks, proteins get out of the blood vessels, and look at their symptoms and the edema that they get. Similarly, if we start getting debris getting into the blood vessels, that would cause its own issues. So the point is, let's say this happens. That means somebody becomes so severely ill that cytokines that are released and the chemical substances that are released, they cause enough of the change in these cells. So what happens is, these cells under the cytokines influence can contract, they can shrink. And when they shrink, they produces more open spaces between them, from which things can come in and get out. So let's say if that has happened, somebody became severe enough, then it is possible that the spike protein entered there. Now let's say when the spike protein is in there, it has to go to blood-brain barrier now. And here spike protein was able to get into the blood vessel, because that blood vessel was in the location of the infection, and the infection, let's say, created enough cytokines that the blood vessel endothelial cells shrunk, creating spaces. But in the blood-brain barrier, that is not going to be happening, because there is no infection here. So ideally, blood-brain barrier would not allow these spike proteins to enter now. But we have seen that study where we saw that the spike protein alone can cross the blood-brain barrier. So now think about it, that how difficult will it be for a spike protein to escape out of cell, number one, intact, then escape macrophages and neutrophils, then escape getting swept away by lymphatics, then have enough of a change in the local capillary system that it can enter the blood system, then it enters the brain, then it escapes the brain's removal system as well and causes an issue. So that would mean a lot of things have to work for a in a relatively healthy person with lower infection levels to have that. But from a clinical point of view, I always say that stand outside the patient, outside the mechanism, and see clinically what's happening. So if clinically there are symptoms of, for example, neurological symptoms, long hauling symptoms, then there is something that is going on. What I saw with Dr. Drew was that he said fluvoxamine really helped it. And fluvoxamine is something to do with the brain's chemical substances. I read Dr. Syed Haider's comment yesterday that he has been using ivermectin plus fluvoxamine, and people are really becoming healthier. So I think that the fluvoxamine with your doctor's advice, with ivermectin together, or an alone one-time therapy with steroids could be helpful. So Jess says, what do you think about the new combination polyclonal antibodies treatment by Eli, like bamlanivimab and stacivimab for the South African Brazilian variants? Actually, the important thing is that now they can actually make those. So let's say we have South African variant. They can simply take its RNA and modify their antibodies binding site according to that, and now they have a antibody. So somebody who becomes sick, they can give them these, and these would work. So Plant Kingdom says, are people with physiological edema safe taking the vaccine? Of course. So you use the word physiological edema, that is a normal thing, so that is fine. Although edema usually is not physiological. Yes. So I saw a comment about fluvoxamine. So fluvoxamine, Dr. Drew said it works very well. Dr. Syed Heather said it works very well. So there is of course, we saw the original studies as well. So there is a benefit of this. Saper Steve says, I read that the virus is mutating with significant changes to the spike protein. If that is the case, then how would the virus still be able to attach to the ACE2 receptor? So that is exactly the point. Many times, so if I draw this, the virus has a problem as well, that it cannot just keep changing itself and become more dangerous. Virus has an issue, and that issue is that spike protein is structured in such a way that the spike protein can bind with the ACE2 receptor and bind with the correct affinity. Affinity means enough magnetism between them. I'm using a loose term here. Enough of attraction between them that this binding is sufficient for virus to kind of get a hold and then try to enter the cell. This is like if you're hanging with a cliff, then your hands have to be strong enough to keep hanging, otherwise you'll be swept away. So as much as virus can make changes to increase magnetism, for example, how would the virus increase the magnetism? Look, for example, sodium, I'm giving an example only. This is not exactly, but let's say sodium and chloride. Let's say spike protein has lots of sodiums that are positive. And then ACE has lots of chlorides that are negative. They are going to attract each other and then they're going to bind. And let's say virus decides that, well, there are more chlorides here, I'm going to make more sodiums here. That means it would have even firm grip with this ACE2. So it's not exactly working through the sodium, it is just changing other amino acids and working with it. The thing is this, the virus does not have a brain to decide what to change. It just randomly changes. meaning when the new babies are formed, they just have randomly new shapes. So one may have a shape like this, another may have a shape like this, another may have a shape like this. And so what happens is, not all of these babies will survive because they need to be able to connect here. Some of them would, and some of them will not. So, Simple Steve, to your question, as the changes occur to the spike protein, there are going to be changes that would not allow the virus to stay there. Here is the problem. The problem is those viruses whose spike protein is enough changed that it cannot bind anymore or cannot bind with strength anymore, these will die in the same person because they just cannot infect more things to create a load than to get out. On the other hand, those viruses that may be able to bind strongly, they may be able to infect more and then create a higher load of themselves, which is then shed by the person and then they go out. So the babies of these viruses are dying as well. They are competing with each other. This is what is called the selection pressure. And so they're competing with each other. Many of them are dying. Many of them are surviving. Some have so strong a grip that they just cannot even break away and they just die there. They're stuck there and they're stuck. Some cannot hold it and they are going to die as well. Some will hold it, then break it away, let the other virus come in, the rest of the virus go in. These would survive. So, interestingly, this virus's lethality is already tremendous. I mean, look about it, how it is going through the populations. So, if it is binding a little more strongly, that only changes the virus's dynamics of making somebody sick faster or not, or have the silent period shorter or not. So that is what we may be seeing. Okay, so I hope that answered your question, Simple Steve. Yeah, so tomorrow, Dr. Lori, Dr. Corey, sorry, is that Dr. Tess, Dr. Corey, and another 3 doctors are going to be with me. Westfield says, I get my first vax tomorrow. Don't know what brand it is. Good luck. You will be fine. Patricia Hoke says, Paul Burke, yes, my point. Isn't it better to go to the immunity through vax than through dangerous infection? And please realize this, infection or vax, the mutations were occurring before and they would continue to occur. And so it is not necessary that the vaccination only would cause mutations. And let me explain one more concept that many people sent to me and said, this may be an important concept. So look, what is happening is here is the virus and here is the spike protein. Correct? And what we are saying is, in some latest discussions, that the vaccine would create antibodies against the spike protein, correct? And then the virus would change these and this area, and these antibodies will not be effective anymore. And then what would happen is that when this virus arrives again, these antibodies may not be effective. Fine, that is understandable. But what is really important to understand is that once a full virus is in us, our body at that time, when the whole virus has arrived, let's say I got vaccinated today, I have this antibody. And then once the antibodies have taken hold, my B cells have become all good, so I am competent against the virus now, and the virus arrives. Now we have 2 ways to actually work with that virus. One is that we are going to try to connect with it, and majority of the cases we will connect with it. Second is, it's not that we would now just sit silently only to attack the spike protein, our immune system is going to destroy the remaining pieces of the virus and do its normal regular thing as well. And that is to pick it up in a macrophage, destroy it, chop it up into smaller pieces, bring those pieces out on the surface and present them, not just a spike protein, and then activate the remaining immune system. So after the actual infection, you may have less, after the vaccination and then infection, you may actually have less symptoms. But if the virus has become changed enough that it escaped the immunoglobulins, then it's just going to trigger the normal immune behavior, and that immune behavior would take care of it. It would just take two weeks at least, which is like a normal infection. I think that what we are seeing with the vaccines is that normal infection level or intensity is less. And says guaranteed yearly boosters. We'll see, Anne. I think because the future nobody has seen, then speculating and then arguing or fighting about that is not the best. Luffy is here, yes. Thank you very much, Homo sapien. That was Luffy. He's somewhere over there. Ni says Dr. Bean said Dr. Gate is wrong because the later said their innate immune won't work. I don't know how much adaptive immune response over time will dampen the innate arm. So let me just explain one more thing. Adaptive arm amplifies the innate arm. It does not dampen it. So if I once again draw something here, here is the mechanism, and we have been talking about it for a long time. So let's say, let's make natural killer cell here. This is a natural killer cell, and let's make a dendritic cell here. Right, so these are two happy little cells. So they're sitting here. Their macrophage is part of the adaptive arm as well. Neutrophil is part of adaptive arm as well. I'm just taking two important ones, natural killer and dendritic. When the virus arrives, natural killer cells normally do not attack the virus itself. That's not their job usually. Their job is to attack those cells that are infected. So now let's say here is an innocent cell just sitting around, minding its own business, not saying anything to anyone, doing its function. And virus decided to enter this cell. Now, when the virus decided to enter it, we just saw what would happen. More viruses will be formed, the less cluster of designation will be there. So natural killer cell can actually identify the cell and destroy it. That is one. A more prevalent pathway is that this cell is going to present the protein on its surface. Then that would connect with these cells as well. Then these, what are these cells? Dendritic cells would eat up the virus itself or broken cells, debris, and they would present the viral proteins here as well, or antigens, which will then cause T helper cells, which are naive cells, these to be. So now look at this. We are going from innate towards adaptive. So naive T cells will become activated. Naive T cell can go T helper 2 pathway. They can go T helper 1 pathway. From here, we may develop a plasma cell that would develop antibodies. Or here, we may have a cytotoxic T cell, which will become active. And cytotoxic T cell would then, in turn, kill these kind of cells that are infected. Now, when this happens, these two arms, they talk with each other and they amplify each other. For example, this T helper 1 cell can release interferon gamma. And from this side here, we can have interleukin 12. Interleukin 12 interferon gamma axis, if you Google it, interleukin 12 interferon gamma axis, you would see that that axis is a amplification system where adaptive arm amplifies the innate arm amplifies the adaptive arm amplifies the innate arm. There are possibilities on T helper 1 side where we have IL-10. IL-10's job is to kind of calm down the innate arm, not disable it. By calm down, what it happens is that the IL-10 would send the messages over to the innate arm to say, please don't release more cytokines. Now, this IL-10 would not make a change in the cells forever. This is like you drink water now and then you need to drink water again after some time. And these cytokines are being released all the time. Then there are T regulatory cells, which have then T helper 17s in them, whose job is to then balance out the immune system. So these systems help each other. And there are some people in which we see dysregulation. These are the folks who are developing cytokine storms. But that is an immune system abnormality that is there before or after. Doesn't matter. It is there. They have it, just like some people have allergies. Similarly, some people have cytokine storm complication, which could occur with the infection as well, which we see. Now, adaptive arms activation will not disable innate arm. For example, let's say just randomly finish the natural killer cells. That's not going to happen. Natural killer cell, I'll tell you how they can be reduced. We have done that discussion in the past. Natural killer cell can be reduced. Number one, if there is a bone marrow issue and the natural killer cells are not just being produced. Number two, when we are stressed out. When we are stressed out, when we are worried, when we are scared, just like the lecture we did today, the deaths and the side effects, and that scares us. Or if we carry this fear in us that, you know what, we're not going to come out of it. I receive so many messages that say that we're not going to come out of this. We are done. These feelings, and again, it's not that somebody has intentionally just decided to be feeling that way. These are true emotions when folks do not see that there may be a solution. And that causes the release of steroids, norepinephrine's, which then in turn causes the reduction in natural killer cells function and number both. So the more I don't listen to news. I don't listen. News people's job is to keep us scared and keep us agitated and anxious. That is their job. And I don't do it because it would just keep me agitated all the time. And that in turn has impact on the body and immune system. So my request is to everyone, just don't become too anxious. Whatever way you can keep yourself happy, relaxed, do that, and that would help a lot. Yes. Rubies are red saying, is it not time? So Rubies, you want me to go away now? Yes. So after this, I'm going to look into it. Yes, Patricia, it is kind of, I'm not trying to avoid the side effects of the vaccines, but I would say one thing from the beginning, from March, April, you can pick up any of my video and you would always see that I have tried to keep cool beans hopeful that we have some solution. May that be vitamin D or vitamin C or CoQ10 or ivermectin or hydroxy or forest breathing or light yoga or gargles or the supplements. But I have always kept ourselves, all of us, on a path where we are less stressed. That has been my objective. Today I was actually thinking a lot. Somebody had sent me a note which kind of made me think those things in the same context of this geared discussions, and which made me think that why have I been doing it? And I found out that throughout this whole time, if ever I had to talk about death, or if ever I had to talk about something, a negative outcome of a vaccine, that was because the data was there and I had to. But majority of the time I was finding solutions that would keep us safe, healthy, happy, and going through this dark time with some idea in our mind that there will be light at the end of the tunnel. We can come out, and look, we are almost there. There are still no guarantees. Would I end up with the other side, this light at the end of the tunnel, or would I end up in some other dimension? I don't know. But we are so far here. And I think that that is a lot of benefit. And that's my basic objective. So my objective is not fear mongering. My objective is not to even support fear mongering. And then fear mongering with the incorrect concepts is just not my cup of tea. This is it. Just, and there is someone who's saying that these vaccines are not right, and many people have said these are poisons. Look, my thinking will be this: whatever keeps you stress free. You don't want to have a vaccine, don't have a vaccine. That is your call. You have that right. It is right or wrong, that's a different thing. It is your right. What makes you less stressful? Take that path. That will be the most important part at this time to come out successfully on the other side. Lewis says, are there actual stories of people recovering from the long haul that you know of, or as of now, only temporarily? So I have seen many of, fewer of my own patients who became long haulers, fewer became long haulers, they have recovered. I am seeing other long haulers who are recovering as well. Unfortunately, I'm seeing also some long haulers that are not recovering. But when I poke a little deeper, there may be what kind of drugs they can take. There is some selectivity there, or some comorbidity, or the dosage, or things like that. That is absolutely correct, Natal Scats. I cope by learning as many facts as possible. That's what I have been doing as well. Absolutely. JMT Hero, keep cool means cool. So we are cool. That's the basic thing. Laura, thank you very much. So Laura is counting the thumbs up. So absolutely. So Rondon says, can I be more hopeful and calmer if I follow? Yes. Look, there is that day Dr. Corey made this comment. He said some people are saying it is placebo. And then sure, why not work with a medicine that is 100% effective as a placebo? Sure. If that makes you comfortable, that gives you the strength that, hey, I'm taking something, I'm relatively, don't leave the mask and the social distancing, meaning don't become totally not careful, but using those things, if that calms you down, then please do that. That has a lot of value. And I had done this discussion. Epinephrine, steroid hormones, these are stress hormones that actually reduce the function of natural killer cell and the number of natural killer cell. So if I sat here and scared you, I am actually reducing your natural killer cells. And if I sat here and made you happy, then I'm actually improving your natural killer cells. DM says we have the right, but they're spending 1.5 billion to coerce us into taking the poison. No, they can at least look how I see some people will become coerced, as you said, is, for example, I have a job, and in that job they say you can't come in without getting a vaccine, and now I don't want to leave that job and go and do something else. I am stuck now. So that probably is possible. But I don't think government, at least here in the US, I don't think they can come in and say you must take a vaccine. Yes, yes. And fun for JC, it's not just that I'm sitting here and preaching to others that you should relax. I have to do the same thing for myself as well. I have to find ways to stay relaxed and calm as well. Somebody was asking me today, um, yeah, a friend of mine called me, and he was saying, what is the biggest difference? How are you personally? This was a very rare thing that somebody asked me, how are you personally? He's a good friend. He called me after some time. He said, forget about business, forget about other things, tell me, how are you personally? How are you doing? And I said, look, for 1 year I have not traveled, I have not met my friends. I have not had the privilege to just, sometimes you meet your friend and you hug them and you put your hand on their shoulders and you drinking coffee together, or you're walking together. Or I haven't had that chance, and I've been in this place for the whole year. So that takes mental toll. The reason I'm saying this is that it's not I'm sitting here and asking you to be relaxed. It is something for me as well. So we are all in it together. Cool. So Romana, tomorrow is the rehearsal. My 8 in the morning or 8:30 in the morning. I was telling Dr. Corey's team, I was saying this is an inhumane time. That is too early. So that is rehearsal. Day after is the recording. Then they would do the editing and upload it on their site. So I do not know exactly when do they upload it, but hopefully next couple of days. Me too. So, Mike, I am actually looking forward to have my vaccine. Nikabali says, need a guru. Cool. Doug is saying that, did you get the antibody test? So, Doug, I was asked by some cool bean that they are sending me the test. So let's see. Hopefully, I'll do it soon. Sniper PD says, Dr. Bean, you have a very soothing voice. Thank you very much. Yeah. So mindfulness, playing, doing yoga, playing maybe video games, talking with your friends, family. Everybody has something that would help them be calm. For example, for me, preparing for the cool beans and then presenting two cool beans actually relaxes me. I have I have so many impacts on the business that I can't even describe. But all of that on one side, and just every day, do you know, when I wake up in the morning, I say, I'm going to create another gift for cool beans today. And I just, open up my curtains and I look at the sunlight and I say, I'm going to create another gift today. And that gives me energy and I work on it. And here I am, good or bad, nice or not nice, whatever. But this is how I stay calm and happy. And I'm telling you the truth. I say it every day when I get up. I say that I'm going to create another gift today. Cool. So Luffy's in the other room, also creating gifts for his people and calling them. Thank you very much. Zooming with cool beans. We should do more zooms as well. That was so good. I loved it. Do you know what I loved the most? And Margaret from Texas, she said, how does it feel to lose control? The fun most thing for me was cool beans were just talking with each other and they're chit-chatting and they're connecting. I loved it. Cool. So let's meet again tomorrow, and I think we should do Zooms every Friday, just like people used to when we used to go to jobs, and then Friday evening we'll sit down together. Maybe we should do Zooms every Friday and half an hour, 1 hour talk with each other. and chit chat. So with this, thank you very much. Please stay safe and healthy and happy and relaxed. That is the most important thing. Continue to doing, gargles. That I think is very, very important as well. And please stay safe. Like, subscribe, and share. There are 3 links in the description. One is to join the Patreon. The other one is to buy me coffees. And the third one is to support this work. And with that, thank you very much. I'll see you tomorrow.